and we're going to talk about how to treat the neckline. So transverse wrinkles and necklines can appear due to a number of reasons: aging, loss of collagen elastin again, sun damage, lifestyle, work, and as we all know, these days we all are using our mobile phones for extended periods of times. Looking down onto the phone ends up giving us a bit of a double chin, giving a bit of a lax skin under the chin area. Genetic inheritance, so some people genetically are more prone to this as well. Hormonal changes, obesity, alcohol, and smoking. To mark the bit of a neck surface anatomy, we all are aware of this, where inferior border of mandible is, thyroid prominence, jugular notch, we all know that. And above the thyroid prominence is the hyoid bone, so we all are aware of these areas. Just keep them in your mind so that you know when I'm talking about the protocol. So the protocol is like this as it goes, just like 3 vectors coming from 2 entry points from both sides. Sternocleidomastoid is the margin that we are looking at. So we're looking at the single entry point at sternocleidomastoid muscle at the height of the laryngeal prominence. And then after doing a local anesthesia, so normally you can give a bleb of lidocaine of 2 mils. What that does is that raises the skin a little bit up and helps you use the trocar or the opening needle to make a opening for the cannula to go in. So I normally use a bit of lidocaine at the entry point as well in this scenario, and then with the linear retrograde technique, I head towards the hyoid bone, then laryngeal prominence, and then towards the jugular notch. It's a guideline. And remember that you're not going to do anything wrong as long as you're not piercing through the structures underneath. So for example, if somebody has got much more prominent lines in towards the mid of the neck, I will focus on that area a bit more, maybe inject a little bit more there and a bit lesser amount on the other vectors. If you want to simplify this, the simplification is this, that just trace the sternocleidomastoid muscles on both sides, mark somewhere in the mid of the neck, and one vector stays, middle vector stays towards the middle of the neck, the higher vector goes towards the mid of the chin, and low vector goes towards the notch. That's it. And I think that would do the trick. And sometimes it's a bit difficult in positioning the patients, especially with the neck. So you have to lie them completely flat with no neck support, and then extend the neck back a little bit for you to go into these areas. So all the positioning and marking can slightly vary according to the shape of the neck, according to the position of the patient as well. Now, if you want to just focus on the area of the double chin, where just below the chin there's a bit of a saggy skin or lax skin, that's what this protocol would help with. So what you are basically going to do is, I'll simplify this. The way I explain it is that angle of mandible, if you look up or make the patient look all the way up, and from one angle of the mandible to the other angle of the mandible, draw a straight line. That would be your area of entry points. So you go to in the upper vectors towards the mid of the chin, and the low vectors towards the hyoid bone, and you will have the 4 vectors, which will absolutely serve the purpose of the double chin in this scenario. It's the courtesy of Dr. Manos Demonitas from Greece, and he developed this technique. So I have seen very good results with this. In these cases, 1 month after one session, you can see the significant reduction in the lines, and you can see the skin getting a bit more tighter visibly as well, not just in terms of the integrity, but also visible aspect.